one of the major causes of blindness is glaucoma. Good day, everyone. On Pharmacy Scarf TV today, I have an optometrist who will be teaching us more about glaucoma today. Please, doctor, can you introduce yourself?
Okay, my name is Doctor Hembe. I'm from the Federal Medical Center, Makurdi. It's a pleasure to be at the platform today. Thank you very much.
Thank you very much,
Yeah, you're
Doctor
welcome.
Hembe, for honoring our invitation and allowing us to interview you on Pharmacy Scarf TV.
Yeah, it's my pleasure. It's
Thank
my
you.
pleasure. Yeah,
Thank you, Doc.
yeah, you're
Okay,
welcome.
so moving forward, let's not waste much time. Let's dive straight into the topic of the day, glaucoma. Glaucoma. So, Doc,
Okay.
Dr. Hembe, what is glaucoma?
Okay, glaucoma is a term that is generally misunderstood by the public. But glaucoma is actually a group of disease entities. And what we are looking at in glaucoma is the optic nerve. The optic nerve is that nerve that takes information from your eye to the brain. So in glaucoma, what happens primarily is that there's damage of the optic nerve. And this could arise from high intraocular pressure, the pressure in front of your eye. So that is primarily what glaucoma is. Thank you very much.
Thank you. Thank you for that. Dr. Hembe is really, really schooling us today. So, please, Doctor, it is glaucoma. What are the causes of this glaucoma?
Okay, well, let me start by saying the risk factors.
Okay.
So, the risk factors of glaucoma, one is that you're a black person. For being an African alone, you're at high risk of developing glaucoma. And then we now dive into the family history to be specific.
Okay.
If your parents had glaucoma or your grandparents had glaucoma, you're at high risk of developing glaucoma. Now, the exact cause of glaucoma may be unknown.
Okay.
Yeah. So, but of course,
Idiopathic.
yeah,
Okay.
it could be unknown. But of course, we know that rise in the eye pressure, we call it the intraocular pressure, plays a major role. So several things could lead to the intraocular pressure
Okay.
getting up. It could be pressure. Just like I stated earlier, it could be that there's a family history of glaucoma.
Genetics.
Yeah, it could be genetic. It could be hereditary stuffs like that. It could be that there was a case of trauma, and it could just happen.
Okay.
So that is just part of it. And then I would love to step in at this point and say it's not about what you eat,
Okay.
or it's not basically your habits don't necessarily play a major role. Because we have cases where parents come to the clinic with their children and they tell us, Doctor, can you tell my child to stop using phone because it's causing the child glaucoma? Those things will not cause your glaucoma. So it's not about your food. It's not say, Doctor, which food will I eat? Eat healthy.
Okay.
And so, but at the same time, we need to differentiate that there's drug and there's food.
Okay.
So let's not, it's not about what you eat, it's not necessarily about your habits, except for some cases of glaucoma that arise from trauma. And I think we'll go more when we look at the types of glaucoma.
Glaucoma. Oh,
Yeah,
oh,
yeah.
wow.
Yeah.
Thank you very much, Doctor.
You're welcome. You're welcome.
So please, there is kind of misconception. I don't know whether it's misconception or an ideology. I don't. I'm trying to use the right term there, but
Okay.
I think it's far from me. But let me just go straight.
Okay.
People say that if you have hypertension, you are prone to actually developing this. Is how true is that?
Well, it's a yes and no, but majorly a no.
Okay.
Hypertension is not necessarily related to high intraocular pressure. That's just the truth of the matter. So you could be hypertensive and not be a glaucoma patient at all. Your eye pressure could be normal, and at the same time, you could have glaucoma. Glaucoma is not just for aged people. Very young patients also have glaucoma. As a matter of fact, we are treating a case now. The child is over 10 years, but the pressure is very high. It's not hypertensive. So ideally, hypertension and glaucoma are not necessarily related. Yeah.
But can it worsen the situation? When someone that has hypertension, can it worsen the situation of glaucoma? Someone who already have glaucoma and has hypertension.
No.
Okay.
Yeah, they're not related. Yeah.
Okay. Thank you. I think he has unlearn and relearn something
Yeah,
today.
it's we
Yeah.
learn every day. We learn every day. Yeah, so that's just it. Yeah,
Okay. Thank you, doctor.
you're welcome.
So,
Yeah.
you said, in the course of your explanation, you mentioned something of probably using your phone and all that. I think that some persons say, or some medical personnel says that when the rays from the phone, TV, laptop, and all that gets into your eyes, though we are kind of deviating, though you mentioned it, that is what I'm just trying
Okay.
to,
Yeah, yeah.
so that you say
It's
something
important
about that, yeah.
to listen to.
Yeah.
Yeah. Okay. Now there are a number of disease entities
Okay.
in the human body and in the eye. Just like you have several diseases in the human body, you have a number of diseases in the eye also.
Yeah.
Glaucoma is just one of the leading cause of preventable blindness, or I should simply say blindness. So there are other eye conditions that excessive exposure to your phone can exacerbate the condition. So there are times like that, but not particularly glaucoma. For some patients, when they use the phones, focus on the screen, your screen radiates in UV radiations. So that could cause a certain level of damage to your retina. But let me also tell you, it's minimal. It's not the way people feel it is. Uh, in most cases of the eye, genetics plays a role.
Oh,
Yeah, so if say in a family there's a case of they have a form of retinal disease, for such person, if you expose yourself to the screen for a long time, you're
yeah.
at high risk of developing that.
Okay.
And then if you look at cases of the support of your eye, we call macula.
Okay.
Macular conditions are not very common to the blacks,
Okay.
but they are very common to Europeans, people in
Yeah.
Australia. These are very common to those people. For such people, when they expose themselves so much to the screen, they are at higher risk of developing such complications.
Yeah.
Just like when you look at a human being, we have several complexions. Some people are have a higher tendency of getting sunburned than others.
Yeah.
For some people, they will stay under the sun, they will never have sunburn. But a certain category of people, if they go under the sun, you will
Sunday.
see it. So we really need to be guided. So we cannot separate mobile devices from human beings. But notwithstanding, I personally recommend that if you are using your screen, you should have an anti-blue lens,
Okay.
or at least a photochromic lens to prevent those radiations. As a common saying in Nigeria goes, prevention is better
Better
than
than
cure.
cure.
Yeah, you don't know what will kill you, so you should be on your guard. So that is just it.
Wow.
Yeah,
Wow.
thank you very
Thank
much.
you.
Yeah.
So, viewers, I just from the explanation from the doctor, I picked something. He said glaucoma very preventable, right?
Yeah,
Very preventable.
very
So
preventable.
we'll dive more, and then we'll get to that point where we'll have some steps or ideas on how you can prevent this. Okay, so Doug, let's go to the types of glaucoma. Do
Okay.
we have types of glaucoma? If there are types, then what are the types?
Okay, surely there are several types of glaucoma.
Okay.
And then you know that in the clinics, you could classify something based on how it's caused. The
Okay.
causative agent, you could classify something based on the anatomical changes that
Oh.
occurred. So trying to classify glaucoma is, we cannot finish the topic here, but I'm going to just highlight some key types of glaucoma.
Glaucoma.
Yeah. So the first one I'm going to call is a primary angle glaucoma, primary open angle glaucoma. So in this form of glaucoma, the pressure is usually high.
Hi.
Yeah. So and then the another part type I'm going to say is the angle closure glaucoma, where the drainage angle is closed. This is
Okay.
mostly in traumatic cases.
Okay.
And in this case, it's a painful form of glaucoma. The pressure is always higher. For the primary open angle glaucoma, the pressure may not necessarily be high. So there are actually sometimes, then there's another type that I need to mention. We call it NTG, normal tension glaucoma,
Okay.
where there's damage at the optic nerve, but the pressure is entirely normal. So that could be another type. Then I also mention another type, which is the traumatic glaucoma. Maybe a patient, due to trauma, the pressure built up and damaged the optic nerve. Yeah, so these are and then there are some form of congenital or infantile glaucoma where a child is born with
With it,
glaucoma.
oh.
There are several cases like that too. So, for the sake of this lecture, I will limit it to these options, but there are more. If we
Oh.
go to clinical basis, we could keep classifying glaucoma. It's a big three
Okay.
on how we could classify glaucoma, but these are the common ones you are going to see from time to time in the clinic. So we'll stop at that. Yeah,
Oh,
yeah,
okay.
yeah.
Wow. Thank you, doctor.
You're welcome. You're
So,
welcome.
what are the signs and symptoms of this glaucoma, or what are the symptoms of this glaucoma?
Okay, one of my mentors will say he wished that glaucoma had signs and symptoms at the initial stage. Glaucoma is an asymptomatic disease entity. So when it comes, in high care, we call it the silent thief of vision. So at the initial stages, it comes
Just
with
like the hypertension, the silent killer.
yeah, it doesn't come with any symptom. You are not going to experience pain. The primary open angle glaucoma, which is the most common form, which is what you are going to see, which we see every day in the clinic. You are not going to experience pain. Your eye is not going to be red. You are going to see very well. So, but it's going to start damaging your vision from the temporal side till you get tunnel vision. And it's difficult to notice that your temporal vision is damaged because for most of your tasks, you are watching ahead. So, but at the advanced level, what are the symptoms the patient may experience? The patient may notice that he's not seeing very well at the periphery. Or some patient may say, I have to bend my head to see at a particular side of my. So they are now looking for areas where there's no damage to see. And then then when we now go to the closed angle, where the angles are closed, it's painful.
Oh,
It's painful. The eye could be red in
okay.
such cases. So now we'll go a step further. That's why we clinicians say, come for routine eye checks.
Checks.
So what we do in the clinic is if you come with a patient, when we are done checking the patient, we check you too. We screen you. We call it screening, and that's why we have
Is that
some.
done? Is that done free of charge,
No,
or
no, now this it
some
depends
other
on the
things?
setup.
Okay.
It depends on the setup.
Okay.
But because I care so much about this, when in a clinical setup, when you bring your patient, I say, are you related to this patient? Okay, I check you also. It's a screening, and that's why we have something like World Glaucoma Week. It's done every year in the country. During this time, we go out and we check because when we catch you on time, it's better. For most patients, when they are presented to the clinic, it's at the advanced level, and at that stage, you only get to manage. And the patient's desire of seeing like a child or seeing way back, most times we are not able to get up to that extent. So it's basically go to clinic on time. So those are the signs and symptoms that I could mention for glaucoma for now. Yeah, thank you. Yeah.
Thank you very much, doctor. So, he has already said it, but I want to re-emphasize on this. Viewers out there, I want to encourage you, just as Doctor Hembe has just said here, that glaucoma is a silent what?
Thief of vision.
Vision. So, and the only way you can actually identify this on time is routine eye checks, because it doesn't really show much signs at the early stage, right?
That
So
doesn't.
please, viewers out there, I want to encourage you to always go for your routine checks to make sure you identified some of these problems on time before it progresses into something more severe. So, doctor,
Okay.
moving forward, I what are the things that one can do or help the person to actually prevent this from happening?
Okay. Just like I said, for most forms of glaucoma that we see in the clinic, they are hereditary.
Okay.
So it's genetic. You are going to get it from maybe your grandfather, your great grandfather, maybe your direct parents. So for such people, I'm going to emphasize early checkups to start on time. And then generally, since we have other forms like traumatic glaucoma and all, you could always protect your eyes using protective goggle if you're under the sun and all. And then eat healthy. if they are fighting, you should not necessarily want to separate the fight,
Mm.
so you don't have one
So
of
I
your
just
eyes. Yeah,
finish. Yeah.
and then, but generally, as a law, one of my mentors
Mm.
will say, maybe in that cases when someone becomes uniocular, has
Mm.
one eye from one,
Mm.
he says, please, if they are fighting, don't be in a haste to separate the fight because you have
Separating.
only one eye. So it's just caution. You have
Yes.
to be a careful person generally.
Mm.
Yeah. So eat healthy, exercise well. It goes a long
Mm.
way because your eye is just part of your body. It's a window to your body.
Yeah.
So when you take care of the entire body, the eye is going to be helped also. And then for elderly patients, this the need for checkup even comes more for elderly
Mm.
patients because as you advance, your life becomes more complex health wise. You're a pharmacist now, you know this. So
Yeah.
for such people, they really need to check frequently, and if there's anything that needs to be corrected, then of course it should be done on time. So that's the best shots for it. Yeah.
Wow.
So
Wow.
thank you.
I've learned a lot here. I've learned a lot. Thank you, doctor. So I think doctor is still emphasizing on routine eye
I
checks,
check. Yeah.
routine eye checks, and he spoke about genetics, where you have a family history of that. Maybe your dad, your mom, someone in your family has that. So you are being advised to start checking on time. You don't need to necessarily wait until you start having some signs and symptoms
Yeah.
before you go to the clinic.
Sure. Sure.
So thank you, doctor. Do you have any general advice to the viewers out there before we
Okay.
end?
Well, before we wrap up, I'll just say that some certain myths about the eye. There are certain beliefs we had while growing up. I myself had those beliefs. First of all, we had this idea that carrots carrots will make you see better. That's an exaggeration. Let me just know the viewers
I
know
used to believe
now.
that too.
That's an exaggeration. Carrots has vitamin A. Lots of
Okay.
food have vitamin A. They are healthy for the eye, but they are food and not a drug.
Okay.
So there are patients who, because of the belief, say, doctor, I went back, I ate lots of carrots, I can see better. There's actually nothing like that. Carrots are just supplements good for your eyes. They will not make you see better. Because for most of the cases that present to the clinic, they are not cases of vitamin A deficiency.
Mm.
So carrot is just supplementing for vitamin A.
Okay.
So if you have glaucoma and you are eating carrots, glaucoma is not a carrot deficiency, vitamin A deficiency disease. So when you eat carrots, you are not doing your best. Now, there are rare form of eye diseases that are caused from vitamin A deficiency.
Okay.
They are more rare these days because of immunization. As children grow up at infancy, they are given shots of all these things.
Okay.
So
Vaccines.
majority of the eye conditions you are going to face in the clinic are not vitamin A
Deficiency.
related. So when you keep taking carrots, you are not doing yourself the best.
But you got mention of the optic nerve.
Yeah.
So probably won't the vitamin A or vitamin A rich food have
Okay.
some good effects to improve
Okay.
the condition
Okay. Well,
of these people?
what I'm very happy here is you're also a clinician. And from your basic anatomy, you should know that the optic nerve cannot be regenerated. It's one of those nerves that cannot be regenerated.
Okay.
So when something happens to your optic nerve, the optic nerve, once it's gone, for most of the parts, is gone. So, of course, carrot is good. I'm not saying carrot is not good. I love carrot. But it's the emphasis people put on carrots that I'm warning about.
And neglecting the other
Yeah,
important,
neglecting the main things.
yes.
I'm focusing on what is not major that I'm trying to. I'm saying so. It's a myth that people always believe that when they eat carrots, they will see better. Now, let me tell you where this carrot idea came in from. It was during the Second World War. So what happened was that the German pilots were spying during the war. So they will see very well. They were using telescopes to see from fighter jets to see some parts of the war zones. And then they began, like people saying, how did we were able to see? So they say they are eating carrots. They are eating carrots. Carrots is making them see better. That's where this whole idea of carrots brought more. I'm not saying carrots are not cool, but that's where this whole gist started from.
The thing is that it's not neglecting the important steps and then focusing.
Yes, I'm focusing
the,
on something else. And then another thing is, for most of the parts, glasses will not correct your eyes. I know my audience may be shocked to hear that. For most of your eye problems, glasses will not correct them. When we are giving you glasses, we say corrective glasses. Our aim is that when you wear them, you should see. So when you remove them, it's back to your eyes.
Yeah.
But the patients have, over the time, interpreted that the doctor is giving me corrective glasses to correct what I have. And for presbyopic patients who are maybe say 38 and above, they always come to the clinic. Doctor, the glasses have spoiled my eyes because without them I could see. Now with them I cannot even see. What happens? They want to use one glass for 5 years. They don't know that their condition got worse, so they need to upgrade their glass. So at that point, they attempt using the old glass. They don't see very well. When they remove it, it's worse. So they quickly say, doctor, you lied to me that the glasses will correct my vision. Whereas the doctor was saying, put it on, they will correct your vision to read. But when you remove it, it's still your normal eye. And it's going to get worse with age. So these are some of the things that we need to know and be well educated about, so that we don't get confused about it. So these are common things we hear in the clinic every day. And so for now, I will not go further. At the risk of not sounding too controversial.
Okay.
So, but these are things we should all know. Yeah, thank you.
Okay. Wow. Thank you, Dr. Hembe.
Yes, you're
Thank
welcome.
you for accepting to be on Pharmacy Scarf TV today to be interviewed by Pharmacy Scarf.
Okay.
And actually, I've been schooled here. I have unlearned and relearned some other stuff here today. And I believe you are out there to have similar experience. So please keep on watching Pharmacy Scarf TV for more medical updates.
Yeah.
I remain Pharmacy Scarf and
My name is Doctor Hembe.
Dr.
And it's a
Hembe.
pleasure to be here once more.
Yeah.
Thank you.
Thank you,
Yeah,
Doc.
great.
Okay,
Thank you
thank
very
you.
much.
Please like, share, comment on
Please do.
this
Follow us
page.
on Facebook. Follow us on YouTube and Twitter as well.
Twitter.
Thank you very much.
Thank you, Doc. Okay. Bye bye. Have a nice day.